Welcome back from the break. We still have Nurse Colleen here to speak about health screening.
So guys, Auntie Colleen was speaking about before the break about gig. So she said the G was for general and the I was for I'm not sure, I can't remember what she will tell us more about
What?
it. And then you have the G. So Auntie Colleen, can you tell us about the G?
Yeah, I will. So let me just go back again. So just in terms of health screenings, we use a systems approach. I said, and we start from the head and we work down in every system. So the first G was general. So with general, we covered the skin, we covered the mouth, the eyes, the ears, the heart. We covered diabetes. We covered the urinary tract system, and just everything about the patient and the history. So that was general. And then the I, we said infectious diseases. Yes, and we spoke about HIV briefly, a screening for that. And that's just a finger prick at your local clinic for free. And then we spoke about STIs, which is symptoms. And then we also just encouraged people to go and get the flu shots.
Yes.
And then the last G is for, I would say in my books, it's for gender. So each gender, the males and the females, have specific systems that we will test things for them. So let's talk about the ladies. So for females, we would encourage young women or ladies in general to once a month do a breast self-exam. So part of the gender segment, I would ask the lady, does she know how to do a self-exam, and then demonstrate it and do the exams with her. And then we would ask, and then we would speak about, and if there's anything there, and depending on the age, we would do the mammogram. So we would refer for a mammogram to see if there's something. And the other important thing for ladies is a pap smear. I don't know how much Houston knows about a pap smear.
I have no idea.
Pap smears are very important for women. We look for any specific STI, and then you can treat the specific STI. And then also we look for something called the HPV, human papillomavirus, which then indicates if the patient could have cervical cancer. So it's a screening, a pap smear is a screening for cervical cancer. So this is for the ladies. And then for the gentlemen, we would look for, and sorry, just obviously for the ladies, we will also speak about the family planning and just what contraceptive she's on, how she's coping with it, dual protection, all of that. And then for the gentlemen, I know guys don't often, but guys 35 and older, especially 40 and older, we would want to do a prostate exams. So you can do a simple blood test, send the bloods away, look for the serum antigen, for the prostate serum antigen, and we're looking for prostate cancer levels. And then the other one is just to teach the guys how to do a testicular exams, also a self-exam, so that they can, if there's just like ladies get breast lumps, men can get a little lump in the testes, and also it could be cancerous. So that would be around the gender thing. For guys, we'll also speak about just dual method of contraception, risk reduction. So we will assess his risk. Let's say risks for STIs, for HIVs, partners, etc., and then speak through that. And then so risk assessment and speak through risk reduction. So you can see that there are so many things we cover in a health screening, and everything. So while there's a model, it depends on the person sitting in front of you, and you treat that person as an individual.
Wow. I'm really enjoying this. So Auntie Colleen, you told us how this come about. So you can tell me why exactly.
Okay, so the why would we want to do a health assessment, or why is regular health screenings? If you can visit your healthcare practitioner at least once every second year, even if you are healthy. So in the past, we only would go to the doctor when we were sick.
Yes.
And I know even some people only go for a sick certificate, never mind if they're sick. But so the reason why you would want to do a health assessment is if there is something, you want to detect that early.
Okay.
You want to pick it up early. So let's say the person has a high blood pressure, and they don't know they've got this blood pressure problem, and they went to their doctor 2 years ago and there was nothing there, and now they're coming 1 year or 2 years later and there's something there. The doctor can say, let me call you back in a month and let's reassess this. So it's for early detection. For many women, for example with breast cancer, if you detect a lump early, so you do your own exams and you detect a lump early, you can really save this young lady or this lady's life later by early detection. So it's for early detection, which leads to early treatment and then also to lifestyle changes. So very important.
Yo, it's very important. Can save your life, yo, doing this whole health
Health
screening. So, can Nurse Colleen help me? Is the G, the I, and the G the general, the
Infectious diseases
disease, and the
and
gender?
the gender,
Yeah.
yes,
Okay.
yes. And please, that's by no means any scientific term. That was just me coming up with an acronym to help people understand all the bits and pieces that we cover when we do a health screening. Yeah.
It's really amazing, eh?
is.
I'm kind of interested in more this
And
information that
you
Nurse
know
Colleen
what?
bring
I
in.
should make me use an acronym. I'll do this. So Nurse Herman, you told us the why and how. Can you tell me what made you do this?
Oh, why I entered nursing?
Yes, and
Okay. The what about nursing? So nursing. Let me just give you a little history lesson. In 1820.
whoa,
Long before all of us were born. 1820, there was this war called the British Crimean War. There was this young lady who was a nurse in the war called Florence Nightingale. And Florence instituted some things around patient care, hand washing, changing dressings, and just the care given to the individuals, washing hands in between patients, and nursing. That's sort of the origins of nursing, and that's why we celebrate International Nurses Day on the 12th of May every year around for the birth of Florence Nightingale. Since Florence Nightingale, there's been many amazing nurses throughout the history. So nursing is based on an ethics of caring. So you care for people, and so you enter a caring profession. And so and a nurse sees a patient from before they are born. So the midwife sees the patient during conception, all the way through life, all the way till palliative care. So palliative care is when they really ill and they're dying, and then even the grief counseling, the grief part. So I think maybe that's why I entered nursing. I like the caring part of
Caring part,
nursing,
yeah.
yes, and you get to be the advocate for the patient in their ill health. When they're weak, you can be strong for them.
That's really amazing, no?
Yes.
Nurse Colleen's caring for the people over here. That's why we needed a health screen and know but more of insight. But right now, we're gonna go for a break, and we'll be back for more. So stay tuned into the seats.
Yeah.